Assalamu alaikum and good morning. In the series of the Anatomy and Physiology lecture of the series, today is the lecture number 11. And the lecture number 11 today we'll go to learn about the two type of the long bone, which is take the part to make the structure of the lower limb of the portion of the lower limb is called the leg, and the leg is the portion of the lower limb which is start from the knee joint till to the ankle joint. This portion of the lower limb is called the leg, and this leg portion of the lower limb is made up by the two type of the long bone. The one bone which is present on the medial side of the leg is called the tibia, and the another bone which is present on the lateral side of the leg is called the fibula. So now we will goes to start to learn about the different type of the structures and the different parts of the long bone which is present on the medial side of the leg is called the tibia. So as you know, the tibia is a type of the long bone, and the three characteristic is very famous of the long bone. It has the three portion. Portion is called the proximal end of the long bone, and the lower portion is called the distal end of the long bone, and the middle portion, which is the almost in the cylindrical and the rounded in shape major portion of the long bone, is called the shaft. So, and that this is the medial bone which is present, which is take the parts to make the structure of the leg of the lower limb, and this bone which is the broader and the toughest and the longest in the shape, in a structure of the leg. So we will go to start from the proximal end of the tibia. This is the proximal end of the tibia, and the proximal end of the tibia, if you will view from the superior, from the upper portion of the proximal end of the tibia, if you are looking over here, is the two condyle is looking over here. This condyle which is present on the medial side, this is called the medial condyle, and this one is called the lateral condyle. This is the medial condyle and this is the lateral condyle. This is the articular facet is over here. This articular surface is here, is the articular surface for the condyle, medial condyle. This is articular surface for the lateral condyle. Both the condyle of the femur bone joint to make the articulation are joint over here, and to make the knee joints, and the flexion and extension is possible between the knee joints. If you are looking on the top of the between the two condyle is the spinous process over here, and this spinous process is called the intercondylar eminence. These spines like structure which is present between the two condyles, this is called the intercondylar eminence, and these intercondylar eminence is again divided into two parts: the medial condylar eminence and the lateral condylar eminence. Between these two eminence, the lateral condylar eminence and the medial condylar eminence, is a notch over here, and this notch is called the intereminence notch. Now we will come up on the interior surface of the proximal end of the tibia. In the interior surface of the proximal end of the tibia is the tuberosity is here, and this tuberosity is called the tibial tuberosity. The rectus femoris, the tendon of the rectus femoris muscles comes and attach over here to give the flexion and extension movement between the knee joint. If you will goes on the posterior side, on the posterior surface of the proximal end of the tibia is a notch over here between the two condyles. This is called the intercondylar notch. This is called the intercondylar notch, and just below of the intercondylar notch is a surface over here, is a ditch or fossa is here, and this surface or fossa is called the popliteal surface or popliteal fossa is here. If on the posterior side, if you look just on the below of the lateral condyle, is the articular facet is here, and this articular facet for the head of the fibula. The head of the fibula comes and makes the joint or articulate over here, and to make the joint. Okay, on just below of the this articular facet is a line or start from the base of the lateral condyle is a line is start from here, and this line is start from here, and it will goes on a oblique in a structure, and this line is called the soleal lines, and this line is called the soleal line. Just at the below of the lateral condyle is another line is here, sharp like line is here, which is directly start from here, from the base of the lateral condyle, directly will goes to and a vertical in shape downward, or the vertical line, and this line is called the vertical line. Now we will come up on the shaft of the tibia. The shaft of the tibia is a triangular in shape, and triangular in shape, because it has the three borders and three surfaces. The border which is present on the interior surface, this border is called the interior border, and the border which is present on the medial side, is called the medial border, and the border which is present on the lateral side, this border is called the interosseous border. You can also call the lateral border, but actually the interosseous membrane is attached over here between the fibula and the tibia to give the more stronger or strength to the tibialo-fibular bones to situated or located in the parallel in the portion of the leg. So it is called the interosseous border. Now the surface which is present between the interior border and then the medial border, the interior border and the medial border, this surface is called the interior surface, and then the surface which is present between the interior border and the interosseous border, this surface is called the lateral surface, and the surface which is present between the interosseous border and then the medial border, this surface is called the posterior surface. So the interior surface and the interior border of the tibia bone, you can feel by touching the leg portion from the interior side. You can feel the interior surface and the interior border of the tibia bone. So it is the skinny portion of the tibia bone. Now in the posterior side, the upper is in the just at the vertical line you are looking is here is a foramen here, and this foramen is called the nutrient foramen. Now we will come up on the distal end of the tibia, and the distal end of the tibia you are looking here is the medial side is spinous or the projection like in structure, and this spinous and projection like structure is called the medial malleolus, because it is present on the medial side, so it is called the medial malleolus. Just if you are looking on from the inferior view of the tibia, and this surface is over here, and this articular surface for the talus bone. The tarsus is the first tarsus is which is take the part in the to make the ankle joint. On the lateral side of the distal end is a notch is here, and this called the fibular notch, because the lower end of the fibula bone is joint over here to articulate over here and to make the tibio-fibular joint. And just on the posterior side is a groove over here, and this groove is for the posterior tibialis tendon will be passed through from here. So It is all about the is the in the today lecture session we'll learn about the tibia bone and different parts of the tibia bone, the proximal end and the shaft and the lower distal end of the tibia. And in the shaft, it is again is three border and three surfaces of the tibia bone: the interior border and the medial border and the interosseous border, and the interior surface and the lateral surface and the posterior surface of the tibia. And the distal end, we learn about the medial malleolus, and then the talus surface, which is present on the inferior surface of the distal end, and the fibular notch, which is take the part to make the inferior tibiofibular joints, and the superior portion is make the superior tibiofibular joint, and the lower it is make the inferior tibiofibular joint. So this is the another famous questions, which is the mostly the in the anatomical viva, the examiner asks from the students how you can identify that this bone is belong to the right side or left side. So this is the tibia bone, and the tibia bone, you you are looking at the proximal end of the tibia of the at the interior surface is the tuberosity is here, and this tuberosity is called the tibial tuberosity. And the tibial tuberosity is always keep on the interior side, and the medial side of the distal end is the medial malleolus, and this medial malleolus always keep on the medial side. Now you can identify this tibia is belong to the right side or the left side. So this now I kept the tibial tuberosity on the interior side and kept the medial malleolus on the medial side. So this tibia bone is belong to the right side of the leg of the lower limb. So I hope you enjoyed a lot from the two-day learning session of the anatomy and physiology of the lower limb, of the portion of the leg. So if you any sort of the queries or any question, you can email me, or you can comment in my YouTube channel inbox. And in the last, I request you all to subscribe my YouTube channel and press the bell button. Then you can get the new lectures. You can get the alert for the new lecture of my anatomy and physiology. I hope your attentions for your learning of the anatomy and physiology. Thank you.